Hello, my name is Chiquili Daniels. I'll be doing my oral soap presentation. My clinical site is Pediatric and Adult Medicine. It's a family care practice in Decatur, Georgia. We see patients across the lifespan, ranging from newborns to geriatric population. Okay, the reason why this case was meaningful to me is because it was a mom had brought her 18-month-old in with concerns of the baby not speaking, and I had the same issue with my son who's now 3, so I kind of understood her pain and her concern, so that makes this case very memorable for me. Okay, we'll start out with subjective information. All right. The identification for my patient is CMD. She's an 18-month-old African-American baby girl who presents to the clinic for a wellness check with her mother, who appeared to be a reliable historian. CMD was born January 1st, 2021 at 39 weeks gestation, vaginally by induction. Okay, next we'll have the chief complaint. Mother states, I brought my baby in for her checkup, but I'm concerned because she's not started talking yet. History of present illness. CMD is the 18-month-old African-American female. She's here for a well visit. Mother reports overall CMD is in good health, but has not started speaking words yet. Her last visit was 6 months ago, where she received her 12 months immunization. Mother reports that CMD has not had any sickness since birth. Mother has concerns about patient's developmental status. Mother is very attentive to her needs during this visit and answers questions about her developmental milestones. Mother states since the last visit, she is up to date on all vaccinations. Today, CMD will receive her 4th DTaP in the office. Next, we'll go with the past medical history. Medical problem list. Patient here for 18 months well visit. Mother reports that CMD has not started to say any words. Her last well visit was 6 months ago, which included her 12 months immunizations. CMD was born at 39 weeks gestation by vaginal delivery with no complications. Birth weight was 7 pounds and 5 ounces. She was 20 inches long. Her 1-minute Apgar score was 8. 5-minute Apgar score was 10. She is up to date on immunizations, has no known drug allergies. Her family history and social history includes mother had gestational diabetes and has a history of GERD. Father, no health problems. Siblings, no health problems. Paternal grandmother has hypertension and breast cancer. Paternal grandfather, history of diabetes, seizures, and ETOH abuse. Maternal grandmother has Alzheimer's and vitamin D deficiency. Maternal grandfather history is unknown. Social history for CMD: lives with both parents, whom have been married for 7 years. CMD goes to daycare Monday through Friday for 8 hours each day. Mother works as a dietitian. Father is a police officer. They report that they use car seats when driving the baby in the car. No smoking in the home. No violence is reported in the home. No illicit drug use. No firearms or alcohol use. Mother reports that all basic financial needs and stability is intact, which includes utilities, waters, clothing, and shelter. Review system is unremarkable for 18-month-old CMD, except for her speech. Physical exam. Vitals are all stable. Physical exam was unremarkable as well, except for the baby's speech. There were no recent diagnostics done. My differential diagnosis included child wellness exam, encounter for immunizations, encounter for specified special exams, and screening for autism. My final diagnosis would include screening for autism. The diagnostic plan for this my plan of care for this baby included checking the baby's weight, length, and head circumference, asking the mother questions, addressing concerns, and offering advice, do an exam on the baby while undressed with the mother present, which includes looking in the eyes, ears, listening to the baby's heart, feeling for pulses, checking the baby's hip, paying attention to the baby movements, making sure the baby is up to date on all immunizations and giving any required immunizations, having the mom fill out a postpartum depression screening as well. I would make a referral to a pediatric speech pathologist at this moment because of the speech delay. Education, I would educate the mother on anticipatory guidance for expected growth and development for an 18-month-old, maintaining a healthy diet and fitness, preventive health care including immunizations, educate the mother to read to the child daily, get the mother opportunities to talk, tell the mother to give the child opportunities to talk to other children and adults, educate the mother on limiting screen time and talking to the child about TV shows, educate the mother on healthy food choices, and childproofing the home. Resources I used to narrow my diagnosis included the Pediatric Primary Care and the American Speech Language Hearing Association. My critical thinking process would include that since the baby is not speaking or saying words this early, I feel as though she needs to go ahead on and get seen by a speech pathologist to see the to try to figure out where the stem of it is coming from to get early treatment for this child. No diagnostics were needed in this case. Like I said, the patient was referred for a speech pathologist. And I would have the child follow up in 1 month to see where we are. My evidence-based practice included current research which clearly demonstrates the efficiency of communication services and supports provided to infants, toddlers, and preschoolers with a variety of severe disabilities. Communication services should be started as soon as a communication delay or disorder is identified. Evidence has proven that. I chose the referral approach based on the evidence-based practice suggestion. My evidence is supported by the American Speech Language and Hearing Association. No alternatives were considered. Holistic approach in caring science. I would collaborate with the patient's mother to understand the extent of the patient's speech delay, so I would get a clear understanding of what's going on with the child. I then used Jean Watson's caring science to listen to the mother and show her that I really care and let her know that I also went through the same thing that she went through. Once she understood that I understood her feelings, she opened up more to me. I feel that by showing the mother I cared for her feelings and making a referral for the baby to see a speech pathologist, this showed a holistic approach to caring for this case. I not only cared for the child, I cared for the mother as well by listening to her and understanding her needs and caring for her as well. Thank you for listening to my soap opera presentation. I hope you enjoyed it. Thank you.